It's now time for health, and I am one of our favorite doctors, right? If not the favorite on the show. Doc, I almost called you Reverend. I promise, Doctor oh God, Zakaria Adam. The conversation we had prior to this is just ringing in my mind the whole time. Doc, how are you doing?
I'm very well.
I like your new hairdo.
Thank you.
Looks really nice. I hope you are well.
Yes, I am.
You had a restful week?
Yes, I did.
Wow. All too soon.
Can't complain.
The month has come to an end. I want to believe so has cervical cancer awareness creation, or there's more happening.
No, it hasn't come to an end. It's a week, not week, it's a year-long advocacy. But then the highlights are usually in the month of January.
Okay.
So at least we have a dedicated period where we speak more about it, where we sensitize more women about it, and even our men, we encourage them to come on board to remind us when, even if we have forgotten about it, so that we get screened. If we have our girls who are between 9 to 14, we get them vaccinated, and then we continue the fight against cervical cancer.
So we are entering February with a vaccination drive.
Yes.
Wow.
So we'd want to talk a little more about the vaccination when it comes to HPV infections, and try and demystify some of the myths. I'm sure you heard about the rollout of the vaccines.
Yes,
Last year, yes, in October, thereabout. So that was one of the highlights for me, for my year, because of the passion that I have with this advocacy when it comes to cervical cancer awareness and cervical cancer advocacy as well. Because we have been fighting for it. We talk about screening, we talk about vaccination, but vaccination was one of the things that, as Ghana, at that time, you would have to privately go and then have the vaccines purchased and given you, as compared to other countries, like developed countries, where the vaccine is actually part of their medicals, and women are called to go get the vaccines done. So as part of the strategy by WHO to try and eliminate cervical cancer by 2030, vaccination is one of the key things. And I'm glad that finally Ghana has been part of the countries where the vaccine has started.
Is it free?
It's been rolled out, yes. So it's free. So it started in October. Actually, that's where most girls, it targeted girls between 9 to 14 to have the vaccine done. So vaccines, usually, the vaccine is against HPV infection. And as we have been speaking at length about cervical cancer, we mentioned that most of it, or greater than 95% of cervical cancer is linked to the HPV infection. You get it. And you have the high risk ones like 16 and 18. That is associated with about 71% of it. So it's prudent that you have the vaccine. So the vaccine would protect, so it's protective to protect you against the infection. And I'm sure people will say that, but why the age bracket 9 to 14? 9 to 14 because at that time they are sexually naive. So they haven't had predisposition to the infection. So in that state, their immune response, if you do give the vaccine, is highest. You get the maximum benefits at that age. But when you compare to other countries, you notice that some countries, some developed countries have the vaccine even to ladies who are at about age 26. Others would even extend it to about age 45. So dependent, but we have just started, and the target is for girls who are between 9 to 14 years who would get the vaccine, which is free of charge. So basically, what happened was that, there's a single dose vaccine that has been rolled out. And there have been 3 doses, 2 doses, and then a single dose. But research has shown that the efficacy for even a single dose is as good as even the 3 dose. And mind you, in 2013, there was actually a pilot that was done for about 13 different districts within Ghana. So the districts were, I think we had about 7 from central region and then 6 from northern region. And they used the 3-dose vaccine at the time. And the 3 dose means that if I do get the vaccination today, the next time I'll get my 2nd dose will be in a month's time. And then the last one will be in 6 months. Okay, so they started off and they had about 94.9% for the 1st dose. And then subsequently for the 2nd dose, when they checked when they started again, noticed that it had dropped to about 89.4. Okay, and then subsequently the last dose even dropped to about 74.5%. So this also just goes to buttress the point that if you have multiple doses, you may get people not completing the vaccination. So why not, now that we have the funding to vaccinate, why don't we do the single dose? And that has been taken by...
And it works just as effectively as the 3 doses?
Yes, it's as effective as the 3 doses. Okay. So that is what is available now. And it was a school-based program where you go into the schools, speak to the teachers. Teachers have been sensitized. They've been even spoken to be advocates as well, so that they help parents accept the vaccination and then get the vaccine done. So it was a school-based program, and that's a way to actually be able to get all the people or all the girls between that age bracket, so that they are vaccinated to help prevent cervical cancer in the future.
I know the regional spread is such that Accra is always the center, but is it nationwide?
Yes, it's nationwide. So it's a nationwide rollout of the vaccine.
Do you know the proportions to which each region?
I won't be able to tell off head now, but I think total uptake was about 84.5%.
That's quite high.
It's quite high, but we still have
a lot more.
A lot more. And this is as a result of what? Some of the misconceptions.
Exactly. I was coming to that because I remember covering that story extensively. And most of the pushback was coming from parents. Especially, rural areas. They were pushing back.
Did you hear any of the misconceptions?
Yes, that the children would not be able to give birth in the future. It would destroy their wombs.
But science is a way. All of that.
Yes, one of them actually that is going around is what she mentioned. That it's a way towards reduce our population.
Some people want to do birth
control,
and
then to cause infertility, and even what they were using is the fact that white girls. Why didn't we include the females? So we are.
Why didn't you include?
Why didn't you include the boys? Okay, but so once it's girls who have been targeted, and it's something related to a sexually transmitted infection, then it means that it's either one, the fact that it's going to cause infertility in this group of people, so that you reduce the population, and then also the fact that the funding is coming from outside. It's a way. It also gives that same.
Of course, I'm not even justifying this, right? But we know how some of these donor groups, right, and largely they were for soft power issues. So soft power in the sense that yes, they are helping you, an impoverished country, you a smaller country, but indirectly it fits into their national strategy, it fits into their national interest. So yes, USA was giving us money, but they were not giving us money because they loved us more than themselves. It was because they also want certain things from us. So I don't know, Doc, can you help us? You've done the research, right? You've gone through what the researchers have been saying. Is there sufficient
evidence,
research for our case on cervical cancer, maybe among blacks, among Ghanaians, sufficient enough to justify a lot of the actions we take within the space?
Okay, all right, yes, there is. So there's a lot of research, especially even with the hospitals. So once you come in, people are taking data on the cases that do come in, and that is how we are able to tell the prevalence and then also the incidence for each year that comes in. When it comes to this vaccine, after the uptake, records have been taken, and that is how come we know that after the October, these were the numbers that were covered. That's the 84.5%, leaving us with some percentage still needed to be covered. Also, aside, so then why did we have 84 and not 100%? And that's when you notice that some qualitative study was done to be able to interview people to know why we didn't get about 90 or 100% uptake. And it came out as misconceptions was one of them, the greatest of all. And one of the main misconceptions is that it's going out there that people think that when these vaccines, when girls take these vaccines, they are going to be infertile. It's a way to reduce the population. So they are coercing other parents to not give the consent for their ward to be vaccinated. Another is that they say that it is actually a license for the girls to start being promiscuous. So once they take these vaccines, it's a license that, okay, I can just go ahead and be sexually promiscuous. You get it? So that's another misconception, which I think is not. We need to debunk it, or we need to talk about it. Another could be that, okay, once I take the vaccine, it means that the vaccine will rather give me cancer. Okay, so it's another misconception that was going out there about the vaccine. And also, some people say that, why 9 to 14 years? Because if my ward is only 9 to 14 years, if I give her the vaccine, she's too young to have such a vaccine. So, and one of the things is that most of the parents did not give consent. So when you go to even the private institutions or the private schools, you notice that one of the main stumbling blocks was the fact that most of the head teachers were demanding that parents need to sign consent before the vaccine is given to any of these children. And it also reduced the number of vaccine uptake across the country.
Did you see disparity in the vaccine uptake, right? So for example, if you compare some of the northern regions, Upper West, Upper East, as against Central Accra, do you see some significant disparities?
I would say that averagely the disparities may not be too significant. Most of them were just about 70, a little bit 60, then you come to 80. You get it. So the disparities were not that much that you see that, okay, in the northern regions, most of them took, as opposed to Accra.
Oh, interesting.
Yes, so it was all about the same.
In which areas do we see the incidence to be more prevalent?
Okay, so that I would say that we have a lot of data in the regions that do have the facilities to be able to screen and treat. So most of the regions that do have so talking about the teaching hospitals, talking about the regional hospitals, because they do have the capacity to be able to treat and then screen and treat, as opposed to, we mentioned VIA. For VIA, you can actually do it in even very low resource settings. So that you can actually do it, and it's a very good way to be able to screen the patients and then treat them. So even in Bato, there's one doctor there who actually is doing a lot of work there.
Doc,
concerning
will there be a time where babies will be vaccinated? Will there be a time where babies will be vaccinated? Or
well, we're
sticking to the age.
I think so. So mostly, right now, what research is saying is that once you are sexually naive and looking at it anecdotally, looking at it, is 9 to 14 years. That is where you would have, your immunity would be able to be optimized. You get it? So it's just like I mean, the other vaccines that you take at birth and all of that, but for this 9 to 14 years has been shown by research that is the best time. Possibly in the future, if more research is done, we may be able to look at that aspect as well. I'm
sure we'll continue this conversation next week. I'm eager to have you tomorrow, but I'm sure in the course of the week.
Yeah, and then also I think we should just add that the boys as well in other countries are vaccinated between 9 to 14 years.
There'll be a time that will be in Ghana.
But what we are banking our hopes on is the fact that if you have a lot of the ladies having vaccinated, you may reach a point where we call something herd immunity. And in that sense, you wouldn't need to vaccinate the boys, and we would have been able to eliminate the cervical cancer as we are promising by 2030.
All right.
Thank you so much for your time this morning. Dr. Oum-Kalsoum Adam, a maxillofacial surgeon and also a public health advocate. An incredible job you've done in the month of January. Hopefully we see more of that as we start this month of February.